Hey guys, again, so this video is going to be over supportive structures of the foot and ankle. So you can see the model that we're using. This is the model that you'll be tested on. But I also want you to think about the role of ligaments in supportive structures. Here we're talking about ligaments specifically, and they're going to be designed with the purpose of restricting movement. So some of them are going to restrict dorsiflexion, others will restrict plantar flexion, and then inversion and eversion, and that's where you're going to hear about ligaments for the most part. This is going to be broken into multiple videos. So first we're going to look at what we would call the MCL. It's the medial collateral ligament. Just like you have in your knee and your wrist, elbow, all that, you've also got one in your ankle. But here for the ankle, I'm going to turn it sideways so you really get the full view of the foot. We actually have a complex of 4 ligaments. Now these ligaments are going to be named based on their attachment. So we're going from the tibia either to the talus or to the calcaneus, and then we also have one that comes to the navicular, which is going to be a little more distal than that talus, remember? All right, so we have the tibiocalcaneal coming straight down there to the sustentaculum tali. Yeah. That's that big shelf on the talus. Then we have one here, and we have one here. Do you see that little skinny sliver right there? That stops here. This one comes way far forward. He comes all the way to the navicular, but this guy stops at the anterior portion of the talus. So that's going to be your posterior tibio-talar and your anterior tibio-talar. Now, circling back to connect your loop, remember on the talus bony landmarks, we had the tubercles of the talus. You had the medial and lateral tubercles of the talus. Well, this posterior segment of the MCL is going to anchor on that medial tubercle. The posterior portion of the LCL is going to anchor on the lateral tubercle of the talus. So recap here, we have our posterior tibio-talar, our tibiocalcaneal, our tibionavicular, and our anterior tibio-talar. These are going to restrict excessive eversion. These are not muscles, so when they shorten, they don't shorten. If they were muscles, yes, they would produce inversion, but these are not muscles. They're like duct tape. So they're going to restrict movement typically in the opposite direction. Okay, so they're going to restrict excessive eversion. And they're also going to restrict a little bit of dorsal and plantar, if you're looking here and here. So he's going to restrict a little bit of dorsal, he's going to restrict a little bit of plantar. But mostly you're going to be thinking about talus, anterior and posterior shifting. And that's pretty much the role of the MCL. Again, that's your MCL. You would need to know it together as a group and then also individually each of those 4 ligaments.